can you speak a little to your experience working with the yoga triangles?
Yeah.
And things that you like about them?
Yeah.
Things that you maybe use them for already? And any feedback or risks or in particular myofascial release techniques that you think are helpful? Can we kind of dive into that?
Yeah. Absolutely love incorporating the yoga triangles into the flow here. When you first showed me this thing, immediately, just looking at it and the angles of it, I already began to, imagine in my mind, oh wow, these corners are awesome. They're so dope and so useful. And so I do a lot of, I encounter a lot of practice members with pelvic rotation, right? And so the typical wedge, if I have a practice member lying on their belly face down on the table, and I get a sense that there is hip rotation and I want to push one ilium back and push the other one forward. And so we have these wedges. This is nothing new. However, the steep of the triangle is much higher. This slope of the yoga triangle is much higher than the typical ones that we have access to, and so I can get a much more aggressive rotation, and I don't have to have them on these as long. And sometimes it's so severe, the rotation is so severe that this higher slope is just a godsend. And so I utilize them that way as well. And also this creates a beautiful fulcrum for the base of the occiput. The occiput is the bottom of the back of the skull. Geeky people out there. And so if you put this little corner in what we call the sub-occipital, which is right below the occiput there, it just creates just this beautiful fulcrum and this beautiful crease right up under the occiput to release that fascia that's coming right down from here to there. And so I utilize them that way, instructing a practice member to do that sometimes. Also,
do you do one or two?
On the occiput, typically I'm using, if they're on the table, depending on the size of their heads, sometimes I do one, sometimes I do two.
Okay.
Yeah. I find that it's super stabilizing if I can to put the one in between the gap of my headpiece, and it just and it kind of I'm always telling them, hey, let that head hang heavy, like you can't support it, like make your head feel like you can't support it, and again, if they can't do it initially,
that verbal cueing is everything, right?
You
gotta get in their head.
Yeah. So take a couple of breaths, and like your head is so heavy, and then you can just see the head fall back another inch and a half, right? Right. And so, it's been a really wonderful instrument to use to facilitate healing.
Hips.
Yes.
Neck.
Yes. Also, this is a superb passive way to release psoas. Typically, I'm releasing psoas with my hand. They're lying on their back, and I am using my hands to get a sense of trying to get a little bit more precise of where their particular hang up may be, and I'm leaning in. And for most people, this is not a pleasant experience. Okay, this is not present. Releasing psoas is typically not a pleasant experience, and so and sometimes, and again, most of the times I'm having to do that.
Maybe even unpleasant.
Breathe and tell your body it's okay. But having them use the yoga triangle, here with them lying face down on a mat or so, and of course it takes some effort to teach them the placement for their body and where it needs to be for them. But it can be a way for them to experience more ease with it's kind of a mental thing.
Yep.
This is on the floor, and I am placing my body on it, right? With the intention of releasing psoas. And if you aren't familiar, psoas also is notorious for storing trauma, emotional trauma, emotional distress. And so many times when we release psoas, people have emotional releases. And so the Chiropractor is a way for them to do this with a bit more, I guess, privacy and dignity. They can have it on the floor and they can lie down and just kind of let things happen.
And it's also nice for you too, right?
Exactly.
You don't have to be as in
there.
It's hard to have a release in an area that you feel protective of
Exactly.
with someone unless you are fully open with them. And that you know, that takes, I don't know how long it takes for you with a client, but for me with students in yoga, it can take years, literally years. I had a regular who came to class, and in Shavasana she would have her hands like this, and she would always tell me, you make me so relaxed. And then one day I wrapped her hands in blankets and I set her wrists over the triangles.
Yeah.
This was like 6 years later. She fell asleep. It was the first time I saw her relax. So it took her 6 years.
Wow. Right.
And it took me leveraging a tool to help her find that. But in her mind, she thought she was relaxed.
Right.
You know, it's
Right.
wild.